If you missed the last video, this is going to be questions and answers. Hello everyone, my name is Steven. I'm a third year dental student and we are answering your questions today. Once again, I appreciate all of you who reached out and asked me questions. I'm super excited to get into more of them today and to answer more of your questions. If you haven't seen part 1 of this little mini series of question and answer, go check that out. It'll be right here and you can see a bunch of other stuff talked about and answered. But today we're getting into a whole lot more. Just any advice to make it through my first year of dental school? Crying face. Pretty simple here. I'm going to tell you to keep your head up and to trust in the fact that you can 100% do it. There is not a single scenario, a single world in which you don't make it through your D1 year. It's going to happen. Everybody's going to make it through. You just have to stick with what is directly in front of you. Do what is the next thing up on your to-do list. And that's all you have to worry about. Don't worry about the year as a whole. Don't worry about the entire month ahead of you. Just worry about the next task, do that, and then move on to the next one after that. And if you want to see a full video that I made back when I was just fresh out of D1 year on this topic, you can check it out right here. You may have already seen that, but that's a little bit more of my thoughts on D1 year. Why become a dentist and not a doctor? Great question. And this one is something I should probably make an entire video about, but I've never felt educated enough to speak about physicians and the medical profession. So I've always just sort of stayed away from the topic. There's actually a video I recently watched by a woman named Faye Bate, and she basically talked about why she was dropping out of medical school. And I found it very fascinating because a lot of the things that she was sort of complaining about and having gripes with in the medical school world and in the medical world in general were just things that are rarely, if ever, experienced in dentistry. Also, importantly, her perspective was from the UK system of medicine over the pond, and we're talking about the United States most likely here. But in my opinion, I seem to see so many more people really invested in loving the career of dentistry over medicine. There are a lot of people that I've seen that have dropped out of medicine, passionate, smart, driven people who have gotten into it and for a variety of reasons usually gotten out of it. And I'm not saying that medicine is bad. Medicine is fantastic and there are so many different career paths within medicine. It's a much more diverse career most likely in terms of what you can do, the specialties you can pursue, and the types of doctor you can become. But in terms of dentistry, I see so many people who love the profession, love what they do. I think it's just a perfect storm, at least to me, of the science world, of working with our hands and actually like building things up. And then of course we have the pharmacology side, the actual treatment of the human body side, and then building a private practice, a business, a small business with a staff of people. Those are all things that are really attractive about dentistry that will draw people in and continue to do so. And some of the things that drew me in when I was considering the entire process. Are you sticking to general dentistry? If not, which specialty will you be going into? And if you're sticking to general dentistry, which specialty interests you the most? I will be sticking with general dentistry. I am super excited to be a general dentist. I think it opens up so many doors. And the cool thing about general dentistry is you can essentially do all of the specialties and whatever you tend to gravitate to over time, whatever your community needs, whatever people value in the area in which you're treating people, those are the things that you can kind of focus on moving forward into your career as a general dentist. You can really focus on endo if you have an area where people have a little bit more money and want to save their teeth, or you can do more fixed prosthodontics and things of that nature. There's just a lot of options within general dentistry, and nowadays there's even more options with a bunch of emerging technology that I'm excited to get into as a general dentist. But to answer the second part of your question, if I had to choose a specialty that I probably liked the most right now, I think I said this in part 1, but it would probably be fixed pros. I really enjoy the process of crowns, crown preps, all of that stuff. And I'm looking forward to doing a lot of CAD/CAM dentistry in the future. That's something that I will personally be investing in when I get into my practice. So we'll talk about that in the future. In the clinic, are you provided with an assistant? If not, do they ever give you training with an assistant, or do you have lab one day and assist each other? So we absolutely have assistants in the clinic at UTHSC. There's a big guild of assistants. They're all wonderful people, and they're extremely knowledgeable and helpful to us young dentists as we work and learn. I worked with an assistant just the other day on my first filling. Her name is Charisse, and she's awesome. And, I don't think I necessarily would have gotten through the appointment, certainly wouldn't have gotten through it as smoothly as I did if it hadn't been for her and her help and her knowledge. So we absolutely work with assistants. And if we don't work with an assistant, we can work with each other. We can assist each other. That's something we do a lot in the beginning of D3 year when everybody's just trying to get their footing. And there are also certain specialties where assisting gets you points. So for example, pediatric dentistry, in that specific clinic, we need to assist because it's part of our requirements and it gets us points. So there's a couple of options in terms of assisting. Do you see many non-traditional applicants in dental school, for example, music majors? This is something that is becoming increasingly prevalent and increasingly true. I specifically was an English major. I had my focus and specialty within the technical communication side of English. And I have a lot of classmates that were non-traditional majors. I have a great friend in dental school who's writing a novel and plans to write a series of novels. He too was an English major. There are many different options, many different backgrounds that get people into dental school. I often tell people, do not be concerned with what your major is. Just make sure you get good grades in college and be passionate about what you're learning. Because I'll tell you this too about the English for me specifically. English directly impacted my performance on 1, my personal statement, and 2, my interview. When I went into my interview, I was able to speak more eloquently because of the training that I had in the past couple of years in my English major. And also, I was able to write a wonderful personal statement with my skills that I developed in just writing as a concept. And that really, in my opinion, helped. And it was also able to inform the topics that I discussed in those processes. And so overall, it was great for me, and I do not regret a single aspect of that. So if you're looking at something, just like I said in part 1, pick what you're passionate about and follow through with that. Since I started studying dentistry, I find myself looking more often at people's teeth than in their eyes when talking to them. Can you relate, or is it just me? I can relate, my friend. This is 100% what happens when you go into dental school. Once you learn the anatomy of each tooth, you start looking at people's teeth to see what their anatomy looks like, because people's teeth kind of vary just a little bit. Yeah, I relate. What is the biggest advice that you would give to pre-dental students going into interviews? I made a video here about my interview process at UTHSC. I always tell people, be honest, be open, and be accurate. Never tell a lie in an interview, and also make sure that you go through your application and all of the things that you fill out on AdSAS. Make sure you know your application very well, because what they'll do is they'll have your application in front of them and they'll specifically ask you, okay, tell us about this particular experience. And you want to kind of have a little bit of a spiel on how that experience went and how it impacted your pre-dental experience as a whole. Those are kind of some things that I like to focus on, but the most important is be honest, be genuine, and try to convey to them your excitement in a very honest and open way. What would you do differently if you were a D1? Again, what's the latest you should apply for dental school? Some say never apply after mid-September. If I was to do D1 differently, I would appreciate it more in the moment, because D1 year was easy in comparison to D3 specifically. And part of it too for us was we were in COVID times back then. And so I was basically sitting at this desk all the time, just going through lectures, enjoying my days. And I didn't even realize how easy I had it. Now I'm essentially on campus from 7 a.m. all the way to usually like 5:30 to almost 6 some days. And it's hard work all the way through the day, just like it is in many other careers. I'm not complaining, but things have gotten much more serious and difficult than they used to be. So I would have appreciated it more. In terms of applying, I always try to tell people, obviously the advice is apply as early as possible. The best thing to do is to apply the day that the application opens up for you. And that the reason for that is dental schools sort of accept in a rolling fashion. So they start bringing in people for interviews immediately in that first group of applicants. And it just becomes more difficult once you get further and further into the year. I would assume you're referring to this year. If that is the case, go ahead and apply. There's no reason necessarily not to, but your chances of getting into dental school are best if you're applying early in the application cycle, and that's just going to be the case every year. And also the same can be said for the DAT. Take that as early as possible so that you have your score and it's in your application when you go to apply. And one more quick note about the DAT, never take it as just sort of a test trial run. Every time you take the DAT, it should be you going in and attempting to get a 30 on the freaking thing. You want to try to go in and do perfect on it. There is no such thing as a trial run. I'm going to take it and just see how I do, because schools see every score that you get on the DAT, and you want to try and put your best foot forward every single time you take it. How do you think dentistry has influenced your personal development overall? In a weird way, I feel like dentistry is excellent at showing us that A, we don't know something, but B, we could probably figure it out with enough effort. Somehow both humbling and motivating simultaneously. Yeah, I agree with this completely. And how has it affected my personal growth and development? I think recently, as I've actually gotten into dentistry more so than just school, it has caused me to come out of my shell even more than I would have been. And I find myself communicating with just a wide variety of types of people day to day. I mean, I have patients that are 16 years old, and I have patients that are 81 years old, and also all sorts of different backgrounds, life experiences. And it's my job to communicate with them and to really be there for them in terms of their treatment. They're looking to me as someone who is an expert or someone who has built up this knowledge in this profession, and they're looking to me for help. And that's one of the reasons why I got into it. I wanted to have that responsibility and to be able to provide the help and care for people. But it really has just been a huge communication thing. I've really enjoyed my conversations with all of my patients, hearing their backgrounds, hearing their stories about their families, about all of their life and their work and the things they've done. It's been really fruitful, and that has been, for me, part of the growth and development that dentistry has provided. But also too, I think there's a lot to be said for learning and constantly being a student in many ways. We are never experts. We're never fully there. We never fully know everything. There's always that aspect of I'm looking up and trying to learn. But as you get older and further into it, there's the beauty of being able to look back and to help people behind you. So I talked about this with Dr. Sama Solomon in our great conversation. I'll link that right here. A lot of videos for you to check out. And we talked about being sort of a lifelong learner and trying to continually be a student and be a teacher at the same time. What are some of the things you'd do differently if you could go back to summer before D1? Would you start studying for some classes, lifestyle changes, etc.? I think I actually handled this really well back then. I always tell people, really enjoy yourself. Do not start studying. Maybe that's bad advice if you're trying to specialize or something, but it's just, there's so much to do in dental school. It's 4 years of just difficult pain in many ways, hard work, nonstop stress is involved with it. And there's just plenty of time for that. Just enjoy yourself. And I know this is really hard to do when you're a few weeks away from starting. You're really excited. I personally kind of took my own advice there. I really enjoyed the months leading up to starting dental school. I did a bunch of woodworking and reading and journaling and running and all sorts of things that I really enjoyed. And it was the best. I mean, who doesn't want to have that, where they're in their early 20s, they're healthy and happy, and they can just do what they want, essentially, without having to worry about the stress of school, the stress of work, etc. Also too, it was COVID time, so I wasn't able to work even if I had wanted to. So those are kind of the things that I did, and I wouldn't change anything about that. I really look back fondly on that time. And I really also appreciate that I journaled a lot through that time, because I can go back and read my previous journal entries and just be reminded of that period of my life. How stressful is dental school? Do you have time for other hobbies and to relax? Great question, and it's a common one. The fact that I have this channel and I'm speaking to you now means that dental school does not entirely consume one's life. We certainly have time for hobbies. We certainly have time to relax. I mean, right here, I have a book that I've been reading, and I'm almost through with it. This is Dune by Frank Herbert. There's plenty of things that you can do in the life of dental school, but it does get harder and more time consuming as you go along. I have found specifically in my third year that I don't have nearly as much time as I used to. And also too, I have a puppy now who's down here in the crate. But there are a lot of things now that are taking up more of my time. You just have to try to make time for the things that you enjoy. And so whether it's working out or reading or having a YouTube channel, all the things that I enjoy, there is always time for it. And once again, I think this channel should be to all of you a testament that you can have a life, you can have hobbies and passions outside of dental school. 100%. What is the course load like and the time you commit to studying in dental school? I know it depends on what year you're in, but I'm specifically talking about D1 and D2. Yes, good question, and another common one that I get. And yes, it entirely depends on which semester you're talking about, how far into it you are. D1 is essentially like undergrad with more lab. It's kind of the way I always like to describe it. D2 is a lot more heavy on the course load and heavier on the lab. Still doable, something you can still get through, but it is going to be tougher overall. But just generally speaking, it's a lot of information, and you have to just try to do your best with getting through as much of it as possible and learning as much of it as possible. It's not something that we're all going to be able to just learn everything. There's just too much. But if you can kind of hit the high yield things and learn the big concepts, you'll be able to get through it. But yeah, it is kind of like a ramp because D2 is more difficult than D1. And I found that D3 is in a different way more difficult than the past two, just because now we have clinic. I have like 27 patients at the moment. All of them have their own needs. I see them all the time. I'm in the clinic a ton, doing a ton of work there. But we also have like 6 to 8 courses, I don't know how many it is exactly, that require time and effort. And we have individual exams pretty much weekly now for those different courses. So it is just always a lot. And that's one of the things that you're signing up for. But if someone like me can do it, you can do it. And I mean that sincerely. People say stuff like that all the time, but I promise it's doable. It's scary when you look at it. And I hope that I've never made people think that it's something that can't be done, because once again, I'm a testament to the fact that it can be done, and it can be done by a schmuck like me. Okay, let's go back to Instagram for a couple more questions, and then I'll let you guys go. What software do you use to edit your content? I've talked a little bit about this in the past, but I use the Adobe Creative Cloud. So I have probably, how many apps of theirs do I have? 1 second. I have 1, 2, 3, 4, 5, 6 of the Adobe Creative Cloud apps that I use frequently. If you pay for Creative Cloud, which I do, I think it's like $30 a month, you get their entire suite of apps. So there's tons of different stuff you can do. It opens up a massive world of creative abilities. And once you learn how to use these different apps and you learn how to integrate them together for your workflow and what you do, it is massively enjoyable. Specifically, I use Premiere Pro to edit my videos, and then I use a combination of Photoshop and Lightroom to do the photo editing and like the thumbnail creation and all the other digital design things that I do there. How do you stay sane? Great question. You have to stay sane by doing things you enjoy in life. And I don't mean serving oneself, because I do think if you're a selfish person and you're constantly trying to make yourself happy, you will not even remotely find happiness. But what I do mean is trying to do things that you feel enrich your life in some way. So sitting on your phone isn't necessarily going to enrich your life. And that doesn't mean that it doesn't necessarily make you happy or anything like that. But, reading a good book or going on a nice run, those are the things that I really enjoy doing, and they have made my life much more manageable. I'm also a very spiritual person, so I like to pray. It's something that I do every day. Should do more. I can always do more. But those are the things that keep me sane. Just trying to have a balanced life outside of school and outside of dentistry, because that's going to be a consistent thing in my life forever until I retire. But the things that I do outside of dentistry, those are up to me, and those are the things that can, like I said, enrich my life. So that's why I love running so much. I think it makes me feel physically better and mentally better and clearer. And that's why I've recently enjoyed reading more, because for the same reasons, I feel more mentally sharp when I read, and prayer and being a spiritual person. All of those things are great. Also, have a support system. Enjoy your family, enjoy your friends. Lean on them if you need to, and just appreciate them and tell them that you love them and you thank them for all that they do for you. Those are all things that will keep you sane. Let's do one more. What makes the dental program at UTHSC special? This is an interesting question. I think that for me personally, it is in the state that I love. I love the state of Tennessee. I've been here my entire life, and I don't plan to leave. I'll be practicing dentistry outside of Nashville in a few years. I like the fact that I've been able to stay in my home state. Some of you might want to go and have new adventures and go off into a new part of the world, and that's totally valid, and there's totally merit to that. But for me, being in my state where I can just drive a couple hours and get home to my support system, that has been really, really special to me. From a school perspective, I do think that we have a lot of the same things that dental schools all experience. You're going to go to dental school and you're going to think, there are some certain things that I don't enjoy about this process. There's certain things that I would do differently if I was making the curriculum, certain requirements that I would remove if I was in charge of things. I promise you, no matter where you go to school, you're going to have those conversations with your classmates. Everybody does. And it's actually, like, in a weird way, kind of nice to have those conversations with your friends, because it's sort of therapeutic in a sense. And I'm not saying that I hate UTHSC or that they do things poorly. There's just dental school in general is going to have things that you kind of look at them and you're like, why? but we all get through them. And I will say there have been countless faculty at UT that I've sat down with and spoken to about a variety of different topics and just genuinely appreciated their perspective on it, their knowledge, their expertise. And you know, those are types of things that we need in dentistry. We need great mentorship. We need people who have done it, who have experienced it in their lives, and they can then pass that on down to us, because we need to be sponges. We need to learn everything that we can. And I have really appreciated a lot of folks that I've met at UT that have made my experience better, that have taught me valuable things that I plan to move forward in the future. And really, there are a lot of good people. I mean, the admissions staff is fantastic. The first time I ever came to UTHSC, I was welcomed with open arms by the admissions team, and they've always just had that sort of hometown feel to them, which I really appreciate. A lot of them don't necessarily see themselves on this big pedestal where they're this big prestigious institution that, you know, so many people are trying to, you know, attain, which realistically is actually what they are. So many of them have that sort of small town welcoming feel where they just want to get to know you and they want to bring you into their profession because they feel passionately about it, just like I do at this point. So those are the things that I've kind of appreciated about my school. Hey friends, that is it for this video. And for both parts of this little mini series here on answering your questions, I really appreciated doing this. And it was kind of an indication to me that the channel is growing, because the last time I tried to ask for your questions, I got like 10 questions, which was great. But you know, there were so many questions this time, and I really appreciated hearing the variety of things that you guys were interested in. And I hope that I was able to get to all of those topics and to answer them effectively so that you can take that information and run with it. I cannot tell you how much it means to me that all of you are watching these videos and continue to enjoy them. The channel just keeps growing. It's a steady growth, and it's something that I really appreciate. I am very excited to see where this channel is a year from now, 2 years from now, 5 years from now. It's all going to continue to be poured into by my heart and soul. It's something that I'm really passionate about. So thank you all for being here and for appreciating the content. I will keep pumping it out for you. If you haven't subscribed yet, make sure that you do. I've got another video coming out next week, which will be really fun. That's going to be a good one for the memories, a good one for just the overall documentation of the dental school experience. So make sure you're subscribed and you've got that bell notification hit so that you do not miss it when it drops. And like this video and leave me a comment if you feel so inclined. As I always say, my friends, at the end of my videos, I will see you in the next one.